You're listening to Bloomberg Businessweek with Massar and Tim Stenovec on Bloomberg Radio.
Mike, there's a nursing shortage in the U.S., and our next guest may have a solution. Dr. Iman Abuzeid is co-founder and chief executive officer of Incredible Health, and she's joining us now from, where are you, Austin? I'm looking at the background. That doesn't look like Austin. Not that I've ever
That's
been
the
there.
nicest Zoom background I think we've seen today. That's pretty nice.
Thank you. Austin's pretty green.
All right. So what is Incredible Health, and how are you going to solve the nursing crisis in the U.S.?
So Incredible Health is the fastest growing venture-backed healthcare career marketplace. Hospitals and health systems, they use our software to hire nurses in permanent roles in less than 20 days. Our mission is to help healthcare professionals live better lives and to help them find and do their best work.
Oh, and wait for it, Michael. They use artificial intelligence. So which means if this were a publicly traded stock, it'd be like through the roof right now.
Yeah, right.
So how does AI, what's the intersection of what you do and artificial intelligence?
So this week we announced the implementation of generative AI across our platform, which we're really excited to do. And we're also the first in our industry, or in our part of the industry, to do that. These features really aim to just expand opportunities for nurses and to help further streamline the hiring process too. I will say that even beyond the generative AI, we do use machine learning. We also use algorithms to drive the value here. First area I just want to share is just our resume wizard that allows nurses to instantly create resumes in a high quality resume in seconds in our mobile app. 30% of nurses start the job search process without a resume for a variety of reasons, including socioeconomic reasons like not having access to a computer or laptop, or simply not knowing what a high quality resume is what's needed. And so thousands of nurses have already used this. And so that's thousands of nurses that are no longer left behind in the job search process.
And doctor, how are you utilizing the AI? Are you, is it a chat GPT thing, or are you using one of these big tech products that's already available? Did you develop your own? How are you accomplishing this?
Yeah, so I have a fantastic product and engineering team, and they're using GPT technology from OpenAI.
Right.
Specifically, another feature I wanted to mention is just our customized health system outreach to nurses. So this is an example of a feature that health systems can use to send highly customized messaging to nurses. It highlights, hospital perks and benefits, and ultimately helps hospitals really differentiate themselves from the competition. And since we implemented that, the interview requests accepted from nurses has gone up by 20%.
So why limit this just to nurses? Why doesn't everybody use it?
So nursing is the top shortage in healthcare when it comes to just labor shortages. It's also one of the top shortages in the country, and it's definitely one of the top areas that are the health systems that we work with care about the most. So we're very focused on nurses and hospitals right now in the U.S. Of course, we have plans to expand beyond nurses and beyond hospitals, but for now that's our focus.
Radio hosts,
radio
next.
people,
yeah. They're gonna. The chat GPT is gonna.
The funny thing is this, like, in my career, I've been doing this 40 years. I have never once had to give anybody a resume.
Really?
I don't know.
They hear your voice, John, and they're
It
sold.
must be my charm.
They hear that Barry White voice, and they're instantly sold. But doctor, I'd like to step back just a little bit and talk about this nursing shortage. What caused that? Is it a remnant of the pandemic where a lot of nurses sort of had to step back from their career? Or what's going on that's driving this big shortage of nurses, in your opinion?
Yeah, so it's a long-term trend that's been going on for 10 years, and it's projected to continue for many decades to come. What's happening is that our demand from patients and from Americans on the healthcare system continues to increase because our population is aging. But we as a country have not done a great job of increasing the number of healthcare workers to meet that growing demand. And so the shortage is increasingly becoming tougher and tougher. Now, COVID, of course, was a demand shock, but even after COVID, even now, there's still a shortage. I think you all mentioned the jobs report. When you look at the detail in there, the biggest increase in job gains in the U.S. is in healthcare. So this does continue, and despite the job growth, we still don't have enough healthcare workers to fill those roles.
How many hospitals are using your stuff right now and your customer base?
Yeah, so we work with over 750 hospitals across the country, including large health systems like HCA and Kaiser Permanente, large regional systems like Baylor Scott and White, and many academic medical centers too, like Johns Hopkins and Cedars-Sinai. We also work with over 800,000 nurses. So 1 in 4 nurses in the US uses Incredible Health to manage their careers.
And I assume, do the nurses pay, or is it the hospitals paying and the nurses get it for free? What are the economics of the?
Yeah, it's 100% free for nurses. They can use all our tools, all our features, even beyond finding a job. We have continuing education and a community for them to ask for advice and salary estimators and so on. And it's the hospitals that pay.
I'm curious how you started the business and the different funding rounds you had to go through. How easy or difficult was that? And walk me through the steps that brought you into existence.
Sure. We founded the company 6 years ago. We've raised almost $100 million for the company, and the company today is valued at $1.65 billion. I'm an MD by background. I've been in healthcare. I've been in technology for the last 10 years of my career. And ultimately, myself and my co-founder, my CTO, Rome Portlock, who's a brilliant software engineer from MIT, we knew that there was constant complaints from members of our family, actually. So doctors in my family were often complaining about understaffing. Nurses in Rome's family were saying, hey, I'm experienced, I'm qualified. I apply to 10 places. I don't even hear back. We started to really dig into it. We realized the tools, the processes, the technology in healthcare hiring, a lot of it's not really changed in over 20 years. It's primarily job boards, post a job and hope it all works out. But that's really tough, and that's not sufficient in an industry that has major labor shortages.
Do you have additional funding rounds coming up and the expansion? You sort of touched on that before, but what's next?
So what's next for us, and just looking at 2024, is continuing to invest in our product roadmap, more extensive use of generative AI as well, to continue to expand opportunities for healthcare workers and for nurses, and to streamline the hiring process. We want to make it more and more personalized, more and more automated, just make it easier for everyone to access fantastic opportunities.
And I always wonder with a venture capital-based company, Doctor, sort of the long-term ambitions. Are we perhaps going to see you ringing that stock market bell on IPO day someday, or any hint of what's to come as far as the next phase for Incredible Health?
Yeah, so our vision and our mission is to help healthcare professionals live better lives and help them find and do their best work. So, and this is a very ambitious company. Our goal ultimately is to one day go public, but a lot of work to do between now and then.
All right, let's leave it there. I mean, anything else to add? I think you've covered it all, Doctor.
All right, thank you so much for having me. I appreciate it.
That was fantastic. Dr. Iman Abuzeid, the co-founder and chief executive officer of Incredible Health. Mike, we all have failures and shortcomings.
Speak for yourself, John.
I was going to say, I wasn't going to include you in that list, by the way. Our next guest has turned her failures and shortcomings into something of a science project. Amy Edmondson is author of The Right Kind of Wrong, The Science of Failing Well. I think we have to read this book because, it won the Business Book of the Year for the FT. I am told.
That's pretty impressive, yeah.
Hey, Amy, thanks for being on the program. What was your science project?
My whole life has been a science project, I guess. But indeed, failure is a central thread that runs through it.
And, we're all told in school there are no dumb questions and that we advance and learn from our mistakes. But do we really?
Well, yes, we really do, although we don't do it naturally. We need to learn the right mindsets and skills to actually learn from failures. I do make a distinction between failures and mistakes. Mistakes are, by definition, deviations from known best practices or protocols or recipes, whereas failures can, in fact, be in new territory where there was no recipe.
And Amy, I'm fascinated with the concept of studying a topic like failure from an academic, sort of scientific approach. Could you walk us through how you did that? Did you start with the kids who flunked your class and do brain scans on them? I'm kidding, but how did you approach this subject?
Actually, I mean, let me be more accurate. I don't study failure. I study organizations. And in organizations, there are many failures. So I am fundamentally a management researcher. And one of my core passions is management decisions and management actions that lead to preventable failures, and even worse at times, that inhibit the productive experimentation and innovation activities that would lead to future successes. So we have I see both kinds of errors in organizations: a failure to experiment enough, necessarily incurring failures along the way, and a failure to prevent some of the preventable accidents and bad decisions that we see all around us.
So I'm guessing for all this to work in an organization, you have to have a climate of openness and one that where you're not going to get in trouble if you venture out and make mistakes. And I don't know, for some reason earlier today I was reading the preface to the book, and I'm thinking, like, God, would any of this apply to Congress? I don't think so.
Well, I think in earlier times, it would apply to Congress. Congress is an organization just like any other. And I have to admit that most of the research I've done and the organizations I've studied is done with an assumption of a good faith effort to perform well, but a good faith effort to do your job. And even with a good faith effort to have a really effective organization that is serving its clients or serving its constituents well, mistakes and failures still happen. But when you have an organization where it no longer seems clear that the goal is to perform well and serve the public, then some of the basic assumptions of my research and my findings may no longer hold.
Are there any sort of common causes of failure? Is it simple enough to boil them down to a few things? I don't know, hubris or too much risk taking. Are there any sort of common threads that seem to appear over and over?
Absolutely. See, I identify three kinds of failure: basic failures, complex failures, and intelligent failures. The third kind, the intelligent failures, are the good kind, the kind we want more of. They're essentially discoveries. They bring new knowledge in territory that we haven't plowed yet. So they're invaluable.
Could you give us an example? Any real world examples?
Sure. A scientific, let's say this is maybe an obvious example, but if you're a scientist and you have you're the leading edge of some scientific field and you have a hypothesis that something might work and be a great discovery, and then you try it and it doesn't work, that is a failure, but it is a discovery. It tells you that hypothesis was wrong and gives you new information that you previously lacked about what to try next. That's a science example, but in our lives, just let's say dating. You might go on a date and have good reason to believe this could work out, but it falls short, and you can't call that anything but an intelligent failure. Because you couldn't know in advance that it wouldn't work.
And I got to ask this question because it's one of these market themes that we have. Where does artificial intelligence then fit into what you do and what organizations do?
Well, artificial intelligence, essentially works quickly with a lot more data than our brains can work with. So it could be used to help us prevent these preventable failures that I was referring to before, the basic failures, the complex failures. It could help us when we're about to make consequential decisions that are either irreversible or at least very high stakes and under conditions of uncertainty. It could help us make those decisions with better data, more informed by all the available data. And it could also help us generate better experiments, which would lead to maybe fewer intelligent failures and more discoveries. But still, you'd have to have some intelligent failures.
So you talk about failing well. What's the opposite of that? What's just a failure at failing, so to speak?
Yeah, so there's two kinds of failures at failing. And one is...
And we got to do it in a minute, so...
The failures we get from not trying very hard, from mailing it in, from sloppy work. That's the wrong kind of wrong, right? That's not failing well. And also the failure to experiment, to stretch, to grow, to try new things, and therefore not failing at all. That's also not failing well.
Amy, thanks so much. An absolute pleasure joining us from Cambridge. The author, Amy Edmondson, The Right Kind of Wrong, and we should mention again, the FT and Schroeder's Business Book of the Year.
I'm inspired, John. I'm going to go home and fail at something. I don't know what it is, but
We'll make sure it's the right kind of failure,
that's
Michael.